Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our guest today is board-certified obstetrician and gynecologist, Dr. Karen Niver, and we're going to be talking about advanced maternal age. Dr. Niver, welcome back to Today's Health.
Good morning, Barb. Thank you. It's always nice to spend time with you.
Well, I'm looking forward to talking about this because a lot of things have changed, but let's start with how do you define advanced maternal age?
Advanced maternal age is considered to be age 35 when a woman gives birth, not at the time of conception, but actually giving birth. And that goes back to when amniocentesis became a modality to diagnose chromosomal anomalies. It was offered first to women at age 35 because the risk of having a problem with the amniocentesis, which is a needle being put into the bag of water to extract some fluid to run the fetal chromosomes, the risk of that procedure was approximately 1 in 200. That the bag of water could be broken, you could introduce infection, you could lose the pregnancy. And the risk of a woman having a chromosomal anomaly happens to be 1 in 200 at age 35. So when the risk of the procedure equaled the risk of the potential problem, the definition was made.
Okay, that makes a lot of sense. What's the average age that most women give birth?
That has changed a bit in the past 15 to 20 years. It used to be about 24, 25 years of age, and now it's about 27 working towards 28.
Are more women getting pregnant in their 30s?
More women are getting pregnant in their 30s, yes ma'am.
And what's behind this trend? Do you have any idea?
I think it's a combination of things. First of all, we're doing much better with contraception overall in all age groups. The teenage pregnancy rate has dropped in our country to 13%, which is wonderful compared to where it was 20 years ago. But also women are taking time to develop their careers, to continue and finish their education, and I think to be a little bit more stable in their home or personal environment.
Are there risks or issues that might arise for women of advanced maternal age?
There are many, and that starts with the ability to conceive, which we would call infertility, the ability to carry the pregnancy through the first trimester or miscarriage, the risk of chromosomal anomalies, and then as a woman ages, her body, like anybody else's, is more prone to disease states such as hypertension, high blood pressure, or diabetes, obesity. We pick up bad habits as we get older: smoking, drinking, drug use. A woman may be taking more prescription medications than she would have been in her 20s, and different medications can have implications with pregnancy issues, so a whole host of issues.
I think this is such important information because as society goes and we all think we're younger and younger, I don't think people identify 30s as an age that, gee, I might be at risk. So I think this is really important information for people to know, hey, there might be issues, so I need to take care during this time. Mm-hmm. What are the tests that you can do to make sure that the pregnancy is going well?
Well, with advanced maternal age, we would discuss with the patient different blood tests that can now be done much earlier in the pregnancy than what we had 20 years ago. There are blood tests that can be done at around 10 weeks gestation that are quite accurate in picking up different chromosomal anomalies, mostly 21, 13, and 18 trisomies. Also, the gender of the baby can be identified. Mm-hmm. These tests come back in about 2 weeks, so you still know within the first trimester if things are looking well or if there's a concern. If there is a concern, we would discuss with the woman more advanced testing or diagnostic testing. The screening testing is the blood test. The diagnostic tests can be the amniocentesis that we discussed very briefly, or a chorionic villus sampling procedure where a small amount of the placenta is sampled through the vagina, through the cervix, into the uterus to actually run the baby's chromosomes.
How do you make a decision about which of these tests you use on which women? Or do you use them on everybody?
Well, as I mentioned, the blood test is available to everyone. We certainly encourage it for someone with advanced maternal age. It's an expensive test. It costs about $1,100 out of pocket. If someone is AMA or has a family history of chromosomal anomalies, then the insurance company will normally pick that up and cost the woman about $300. And then the advanced testing would be up to the woman. We would do counseling and review the risks and benefits of either of the studies, and obviously leave it up to her. We also have the 19-week screening ultrasound that we would offer to everyone, and that is an excellent tool. It's not 100%, again, it's a screening test, but it gives us a very good idea of the risk of certain anomalies.
So some of these tests are things that you do for women under the age of 35 as well.
Yes, they are.
This is very, very interesting, but we're going to take a break. We'll be right back and we'll talk more about this.